Hello everyone, my name is Carson Leung. I'm a student here at Concordia University, and today I'll be presenting to you guys about my health fair exhibit, which deal with STD and the college population. As a college student myself, I find that this population have an increased risk of STD due to a lack of just general knowledge and a lot of misconception regarding STDs. Through this presentation, I'll be addressing the stigma that came along with STD, as well as the information regarding the three most common STD that college students get, which are HPV, HSV, and chlamydia, according to the CDC website. So let's get right into it. So what are STD? Well, STD are sexually transmitted disease that first started as infection that passed down from one person to another through sexual contact. The contact route of transmission include oral, vaginal, anal sex, and other intimate activity that involve exchange of bodily fluid. Some STD like herpes can be transmitted via skin-to-skin contact. And we'll be discussing that in a bit because herpes is actually one of the diseases that we're going to be talking about today. So STD are also caused by virus, bacteria, and even parasite, which made up of more than 20 type of STD. So here are some facts about STD. Did you know that 1 out of 4 college students has an STD? Every year in the United States, there are 20 million new cases of STD. STD is much more prevalent and more common in our society than one would think. A lot of people who had STD don't even know they has it because a lot of them are asymptomatic at first. People may not begin to show symptoms until weeks, months, and even years later. According to a scientific research paper published by the NCBI, where they conduct a series of surveys to assess the understanding of college students regarding STD, only 50% out of 350 college students across America are knowledgeable about STD and their condition. So when it comes to STD, there are a lot of negative stigma from our society. Because of this, people who are often diagnosed with it are usually feeling hopeless, depressed, and even suicidal. Because of this, it's important for high-risk population like college students to understand that being diagnosed with STD is not the end of the world. One can still live a long and fulfilled life. Many of these STD conditions are asymptomatic and have no effect on your daily life. And even if they do have symptoms, many of these conditions are manageable with the right drugs and therapy. STD is much more common than one thing. Now let's get into the three most common type of STD that college students have. So the first condition that we're going to talk about is HPV. HPV is also known as human papillomavirus infection, and according to the CDC, in 2018, roughly around 43 million people are infected with it, with many are infected are in their 20s. The route of transmission for this disease include oral, vaginal, anal sex, and with the higher chance of transmission via vaginal and anal sex. HPV are asymptomatic and symptoms may not develop into years later. Most common symptoms are genital wart and genital itching. HPV can also cause cancer, specifically cervical cancer. So if you are female, is very important to get early cervical cancer screening. So most cases of HPV does go away on their own due to our natural immune system. Because HPV is a virus, there are usually no cure actually. There are also no tests to determine HPV status. However, the CDC does recommend women aged 21 to 65 to routinely screen for cervical cancer because HPV does increase the risk for women to get this condition. One good news is there are vaccines for HPV. So if you are between age 11 to 26, the CDC does recommend you to get it as soon as possible. Genital war is also another major symptoms of HPV that does go away on their own. However, there are cases when they don't, and treatment for genital war include cryotherapy, laser, topical, skin medication, as seen in this picture. So the next condition that we're going to talk about is chlamydia. So unlike HPV, chlamydia is caused by a bacteria, and this bacteria name is Chlamydia trachomatis. The CDC reported that there were close to 2 million cases reported in 2019, making it one of the most notifiable conditions in the US for that year, with 61% reported are adolescent and young adult. Chlamydia can affect both men and women, and the road transmission is just like every other STD, which are vaginal, anal, and oral sex. One special thing about this condition is that the female partner can still get infected even if the male partner doesn't ejaculate. This condition is very dangerous for female because it can cause permanent damage to the female reproductive system. The people who are infected may not develop any symptom at all, or if they do, these symptoms include abnormal vaginal discharge or penile discharge, burning when urination, pain and swelling in testicle, rectal pain, abnormal rectal discharge, as well as bleeding. As you see in this picture, there's a picture of a healthy cervix and then the picture of a cervix with infected chlamydia where there are white discharge. It's just look very abnormal. Let's talk about the treatment for chlamydia. Yes, this is a curable disease. One can actually be free from this STD with the treatment of antibiotic like doxycycline capsule as seen in the top corner of this presentation. This is due to because it is, in the end of the day, a bacterial infection. So antibiotic does help the body get rid of it. Laboratory tests can confirm the diagnosis of chlamydia via urine sample and or vaginal penis swab. The CDC does recommend women under 25 and or sexually active to screen for chlamydia yearly because it can give rise to a condition known as pelvic inflammatory disease, which can cause permanent damage to the female reproductive system. Chlamydia also causes pregnancy complications, so we want to detect it as soon as possible and cure it as soon as possible. In addition, many of them are asymptomatic, so it's crucial to get the yearly screen. One more thing is that if you did have this condition, that you did have chlamydia and you are cured of it, you are not immune to it. You can still get it if you have sex with another person who had the condition again, and then you would need to cure it one more time. So the last condition that I'm going to talk about is HSV, otherwise known as herpes. As the name suggests, herpes is caused by herpes simplex virus. According to the CDC, 1 out of 6 people in the United States have this condition. There are two types of HSV, HSV1 and HSV2. So HSV1 is known more of as mouth and oral herpes because the blister symptoms occur around the mouth, while HSV2 symptoms involve blister around the genitalia area, which make it known as genital herpes. One thing to know is that HSV1 can also cause genital herpes via oral sex. So HSV are transmitted via oral sex, anal sex, as well as vaginal sex. One thing is that the non-sexual contact with saliva or with the oral skin area where the blisters are in the mouth can also cause HSV, so be careful who you kiss. The sore from the fluid from the sore can be spread to other part of the body, so make sure to not touch when you touch the cold sore when the symptom does occur. And if you do touch it, make sure you wash your hand immediately to prevent the spread of infection to other part of the body. The people who has HSV may not have any symptom, mild symptom, or no symptom at all. When they do have mild symptom that heal too quickly, people usually mistake them for other skin condition and don't notice it at all. The one thing to know is that the people who does have no symptom can still spread HSV because it's still circulating within your body. And those that does have symptom have these occasional and reoccurrence outbreak that act like a flu. And during those outbreaks, the blister would break, resulting in lesions that are very painful. So for HSV treatment, because it's a virus infection, there are no cure. However, it is a manageable condition. Outbreak of symptom can be treated and prevent from occurring, often with daily suppressive therapy, like the anti-herpes medication. Following a daily suppressive therapy can help lower the chance of infecting it to your partner as well as your baby if you are pregnant. One thing to know is that you must avoid having sex when the outbreak occurs because, as stated in previous slide, contacting with the sore and the fluid from the sore increase the risk of infection. The CDC only recommends screening when one shows symptoms because this is a manageable condition and it's not really life-threatening. Okay, and on the picture above, it shows how to treat a herpes outbreak, which involve using ice pack to lessen pain, don't touch or scratch, antiviral medication, keep your hand clean, and one important thing is stress can also be a trigger factor for these recurring outbreak. So this is a pamphlet from the CDC that have basically summarized 6 ways for people to lower their risk of getting STD. Practice abstinence, using condom, have fewer partner, get vaccinated, talk with your partner, get tested. These are all great ways that one should do. One thing I would like to emphasize on is the discussing with your partner because a lot of people are still have a stigma about STD because they lack the information and the knowledge that a lot of STD conditions are manageable and a lot of them are asymptomatic. They doesn't show any symptom and they have no effect on your quality of daily life. However, it's still important to talk to your partners to destigmatize STD and to be safe for both you and your partner. So here's some more resources for you to use. On the right side we have some national organization, and on the left we have some local Austin services. We have the CDC, of course, the American Transmitted Disease Association, Health Resource and Service Administration, and the American Sexual Health Association for any more information regarding STD, any update on treatments. And on the left side, we have for local Austin, we have a Service of Austin, which is a nonprofit that provides testing for STD, as well as the Austin Public Health Sexual Clinic, which is a local, also provide local testing. The University of Texas at Austin University Health Service provide a lot of resources and testing, also provide testing for students that are enrolling in UT. As a college student myself, the number one thing that I would say to utilize would be look at your school university health service, because a lot of time your tuition already cover the service that you're going to get, and a lot of time the university health service also offer free testing and free screening annually. They also provide a lot of other service like yearly flu shot and things like that. So look into that. So here we have some post-survey question to assess your understanding after this presentation so far. So 3 simple true or false question. So let's go through it together. Number 1, true or false? College students who get STD are destined for a miserable life. That is false. College student, even if you do get a diagnosis of STD, your life is not over. Okay? Many of the STD conditions are stigmatized wrongly because people lack an understanding that a lot of these conditions are curable. A lot of college students get the STD condition diagnosed and they panic and they freak out because they lack the information, and the stigmatized of society just make them feel depressed. And I'm here to tell you, you shouldn't feel like that. Okay? STD, a lot of STD conditions are manageable, some are curable, and a lot of them are asymptomatic. With the right treatment and therapy, your daily life, your quality of daily life should not be affected at all. Number 2, true or false? College student who has STD should be treated with equal respect as any other human being. That is true. Just because you have a condition doesn't make you less value compared to other human beings. Number 3, true or false? College students should use protection to lower the risk of getting STD. That is true. In fact, one can use any of the six other method that listed in the pamphlet 2 slides ago to not only keep you safe, but also your partner safe. Thank you for listening to my presentation. This is our last slide. It is a reference page with all the sources that I utilize. I hope that through this presentation, you were able to gain a deeper understanding and more knowledgeable about the 3 conditions of HPV, HSV, and chlamydia, which are the 3 common STD found in the college population. I also hope you gain a deeper insight on the stigmatization of STD and why it's wrong. And once again, thank you so much for listening, and have a good one.